Hello, good evening, everybody. I'm Dr. Basil Bruno, the coordinator of this CAP-funded initiative. Today, we will be getting on another insightful session of our laboratory quality management webinar series. You do understand that each week we dive deeper into essential aspects of laboratory quality management, which is guided by experienced facilitators who are leaders in the field of laboratory medicine and uh, quality management systems. So our today's session on leveraging digital transformation and information management in quality management system will be it will be aimed at providing valuable insights and practical strategies to improve your laboratory processes. This will be facilitated by Dr. Izuchukwu, who is a clinical pathologist at Medics Laboratories. He's a fellow of the College of is a fellow of the Medical College of Pathologists, as well as the International Fellow of the College of American Pathologists. I encourage you all to engage actively, share your experiences, and take advantage of the expertise available on this platform. Let's continue working together towards strengthening our laboratory systems and for better healthcare outcomes. So, right now, I would call on Dr. Mba, our facilitator for today, to take us through this through today's presentation. All right. Thank you very much, Dr. Mba. You can please proceed.
Hello, Dr. Mba. Your mic is muted. We can't hear you. Hello, are you there? We've just been seeing the screen moving from slide to slide, and there's no word at all. If you can hear me, kindly go back and let's restart because we've not heard anything so far. Thank you very much.
Okay, so this is the outline we are going to work with. We are going to look at introduction, fundamentals of management in QMS, paper-based versus digital systems, transition to digital systems, optimizing laboratory data handling, digital transformation and data integrity, AI in laboratory QMS, challenges and future direction before we conclude. By way of introduction, information management is a system for managing incoming and outgoing patient data. This system ensures that patient data is handled efficiently. Your laboratory will likely fall under either a paper-based system, computer-based, or a hybrid system, depending on the resources available to you and your operational needs. The importance of a good information management system. A well-structured information management system ensures accessibility. It means that data should be available when needed. It ensures accuracy because errors in patient information can lead to serious consequences. A good system ensures timeliness. Prompt reporting of test results is critical for health providers because it helps them in clinical decisions. A good system ensures security and confidentiality. Patient data must be protected from unauthorized access and breaches. Since test results are the final product of the lab, a strong information system supports the integrity and reliability of lab services. So, what is digital transformation in laboratory QMS? Digital transformation in a laboratory quality management system refers to the integration of digital technologies into all aspects of laboratory quality processes to enhance efficiency, accuracy, compliance, and decision making. It involves moving from traditional paper-based and manual systems to digital, automated, and interconnected solutions that optimize quality management, data handling, and operational performance. It's a game changer as it enables faster, more accurate, and more reliable laboratory operations. That is what digital transformation, you can see, I'm moving from manual to digital. So what are the components of digital transformation? Laboratory information management system is a component of digital transformation. Electronic document management is a component of digital transformation. AI and automation, cybersecurity, and data integrity. These are key components of digital transformation in laboratory QMS. And what is LIMS, Laboratory Information Management System? These are software platforms that streamline laboratory workflow by managing sample tracking, test data, quality control, reporting, and integrating with analytical instruments while maintaining audit trails. When we talk about maintaining audit trails, it means that in LIMS, once you make any changes, once you make any entry, it is documented against your name. So you log into the system, and any changes. So it's not like paper-based system where someone can come and make changes and then you don't know who made changes, you don't know who enters some results. When changes are made, you don't know. So it leaves trails in laboratory information management system. It leaves trails on any action that is taken on the platform. Another component is electronic document management. EDM systems digitally store, manage, and control laboratory documents with features like version control. So you are using maybe a particular SOP, and then you update. So with electronic document management, all of them, you can control changes, you can update, archive the old one, and be using the new one. Then even the new one, with time, you can update another version. So all these versions, you can track them, you can trace them if you want to get from where you started from. So all these things are digitally stored in the electronic document management system. With features, you can easily retrieve and you can trace your changes, ensuring that documents remain current and compliant with regulatory and accreditation standards. Then artificial intelligence and automation. AI, you know the advantage it provides. It analyzes large data sets. It can predict when you need to do maintenance, and it can help you in your decision making. While automation minimizes manual errors. Most errors are due to human errors. So with automation, these manual errors are minimized. It accelerates the workflows and improves consistency, together enhancing the speed, reliability, and intelligence of laboratory quality management. And then cybersecurity. Once you go online, there are associated risks. Cybersecurity safeguards laboratory data through measures like encryption and access control. When you talk about encryption, you know, sometimes when you get, maybe depending on the bank you use, when you get your statement of accounts, there are some that you get it as PDF, but before you can open it, it tell you to enter the last digits of your account number or some other passwords before you be able to open it. So this is what is called encryption. While digital transformation offers numerous benefits, laboratories must address challenges such as high initial setup. Use of papers is cheaper than these digital platforms. So the challenges include high initial setup, And then you need to train the staff. Challenges of digital transformation include cybersecurity risk and data privacy concerns. If you don't protect patient data, you might just wake up one day and see the patient details online. And the other challenge is resistance to change among laboratory personnel. However, with proper planning, these challenges can be mitigated, ensuring a more efficient and future-ready laboratory environment. Okay, we'll look at the fundamentals of information management and quality management system. The key elements of an effective information management system. The key elements of an effective information management system. So I want you to just have it at the back of your mind that when we talk about information management, we're talking about managing patient data, both the incoming and outgoing patient data. And you can do it with different methods. It can be done under different platforms. It can be use of paper. It can be use of computer. It can be use of both computer and paper. So, but when we're talking about laboratory information management system, you now know it's just the computerized platform where you use computer to do this. So it's good to just have it at the back of your mind because you keep seeing information management, laboratory information management system, and all such things. So the key elements of an effective information management system is number one, unique identifiers for patients and samples. Unique IDs, they help to maintain clarity to avoid mix-up so that you don't label this patient for another patient. It also ensures accurate tracking. And then standardized forms, test requisition forms. You have to have consistent forms. It ensures all this necessary information is captured upfront. It helps with streamlining processes and reduce errors. When you have a paper-based system, when you get a digital form, it's just digitizing what you do manually with papers. So you see there are similarities. So this one, if you're having hard copy request forms, when you now go digital, you just only digitize, it's still the same request form, but you've now made it digital, can now be accessed digitally. So the same thing applies both to paper-based and computer-based system. So both, they should have logs and worksheets. It helps to maintain clear record of activities and results. Important for tracking and documentation. These are essential for audits and troubleshooting. You know, in most labs, if you're using a paper-based system, you have a log, you have a log where you enter the patient's name, you give a lab number, the test the patient has requested for. And then you have another worksheet where maybe you come for this test, you're only recording maybe urea. And then you have the patient name, then you have the urea results. So it can be in the paper format or it can be digitized. There should be accurate checks. Ensure data recorded and transmission are error-free. There is need for processes to verify data accuracy at every stage. You don't make mistakes at any stage. Then data protection. Safeguard against data loss. Secure storage. So if it is paper-based, you have to safeguard against loss, and particularly for digital-based systems, you have to safeguard against data loss and make sure you have a secure storage. Then if it's use of computers, they have to be regular backups, and secure systems are non-negotiable. Then another key element of an effective information management system is confidentiality. You have to protect patient privacy and confidentiality. The lab is ethically and legally obligated to protect patient information. The reporting systems. Clear reports help clinicians make informed decisions quickly. And then communication. They should be timely and effective information shared with laboratory stakeholders. You know, we keep talking about this communication because these results, they are time bound. For instance, somebody wants to do dialysis. And for every clinical decision, there's usually indications for them. For instance, if somebody wants to do dialysis, there has to be indications for doing dialysis. And one of them might be the electrolyte urea creatinine results, wants to see the level of potassium, wants to see the level of urea, level of creatinine. These are there are values you get. These are indications for doing dialysis. So time is very important, and then communicating this information is equally very important. So they all constitute the key elements of an effective information management system. Okay. Quickly answer this question. Let's just make sure that you are following the lecture. So the next question is, a 55-year-old male patient presents to the lab for a fasting blood glucose test. The laboratory recently transitioned from paper-based to electronic records. However, the patient's report was misplaced, leading to a delayed diagnosis of diabetes mellitus. Which of the following best describes the primary function of an effective laboratory information management system in preventing such errors? A, so you can put your answer in the chat box. Enhancing communication among laboratory staff, ensuring compliance with laboratory accreditation standards, reducing transcription errors, and improving data retrieval, increasing laboratory revenue through automation. Okay, I can see the answers coming, and they are all correct. So an effective laboratory information management system minimizes transcription errors, prevents loss of data, and ensures timely access to patient results, improving overall laboratory efficiency and patient care. Okay, so we'll now discuss paper-based versus digital systems. Effective paper-based information management. Not all laboratories can afford computerized systems due to financial constraints, particularly in environment, with the challenges involved in transitioning to digital systems. So this may necessitate the use of manual systems, but a well-designed paper-based system can still provide reliable service. It doesn't mean that those that use computers that they provide better service. You can still, although it is encouraged that as much as possible you transition to digital systems. But if you cannot afford it in the interim, you can still make the best of the paper-based system that you have. A good paper-based system requires thoughtful design to minimize errors and inefficiencies. Registers, logs, and worksheets are widely used and familiar to most laboratorians. So everyone is familiar with paper-based systems. It makes this paper-based system practical for managing samples. Even partially computerized labs may rely on handwritten worksheets. So you can see some labs that are not fully computerized. So they use the computer in some aspects of the laboratory workflow, and then they use paper. Then before you know it, they now transition to full digital platform. A well-designed log should be easy to complete and allow quick retrieval of data. So even if you are using paper-based system, it should not be cumbersome to retrieve data anytime you need it. Features like clear headings, it has to be clear. That's clear headings, organized layouts, and sufficient space for entries. So when you are using a paper, if you can afford it, there are some papers, use of maybe you are entering results, you are using hardcover 80 leaves. You should do something better. You can use, there are some laboratory worksheets that they are the size of, maybe if you stretch your hand from the tip of your finger to your shoulder, those kind of papers that you flip open, it covers a large area of the clean area in the lab. Those kind of papers, when you use that, you see each one, you can see, okay, these are the places to enter urea result, this is a place to enter creatinine, this is the one for electrolyte urea creatinine. So everything is clear. Then you can use maybe tip cover for the one where you just apportion laboratory numbers to patients. You have the patient name, you have the lab number, You have maybe some details, few clinical details, maybe the sex, age, then the test. You know, a patient can come with, if I want to do some molecular urea creatinine, wants to do reproductive hormones, etc. So you just list all the tests requested. Then you now go to another worksheet where you now enter, this one is just for urea, this one is just for calcium, this one is just for phosphate, this one is just for glucose. So each one, there should be clear headings, organized layout, and sufficient space for entries. You don't have to squeeze. Those that have eye problems, they shouldn't have difficulty reading what is written on these worksheets. So it's good to have specialized logbooks. Additional logbooks can enhance functionality instead of doing everything in one thick cover. Better to have specialized logbooks for some tests. A daily logbook can track patient and sample numbers, while a test-specific logbook can record results. So if you want to do maybe some checks, some statistics to see abnormal creatinine results, easy. Just get creatinine. You want to do, say somebody wants to do research, just wants to work with maybe, let's say, glucose, and just get it and get those have abnormal results. So it makes it easier than combining different, reporting different results in one logbook. Role in generating statistics, we mentioned it. So advantages of paper-based systems. The laboratorians are often familiar and comfortable with paper-based tools. So it reduces training needs. Though it's less efficient than computerized systems, when paper-based systems are well designed, they can still meet critical needs in resource-constrained settings. So these are the best practices for paper-based systems. If you're using paper-based systems, these are the best practices. Ensure all data is complete and legible. Unlike computerized systems, paper records lack automatic checks for missing data. So staff must be diligent to complete data entry in paper-based systems. You know, some people just want to, they don't want to write 58 years, they just write AD, adult. So it's good to put in everything. You never can tell. Somebody might want to do a research and he needs those years, he needs specific years. Adult doesn't help such a person. So you have to be diligent. The laboratory staff should be trained to be diligent to complete the data and then be legible. There's need for legible handwriting. Illegible writing can lead to errors in interpretation. There are some people that when they write 3, you'll be wondering, is it 3 or is it 8? So it has to be very legible. Take time to write it. These are very important information. The report is the laboratory's primary product. That report you're writing, that's the only thing the lab produces. So you have to be very careful in entering every detail on the logbook. The report is the laboratory's primary product and must reflect accuracy and professionalism. Okay, another best practice is good record keeping and storage. It's good to maintain exact copies of reports for archives because without a copy, transcription errors can cause problems later. Let's say you do electrolyte urea creatinine with IS, and then the machine produces there's a printout. You don't quickly discard it because you might enter your result in the result book. And then someone is now confused. Is it 3 or is it 8? And you are not there. Sometimes even you, sometimes you write then you come back, you'll be wondering, is it 3 or 8 that I wrote there? So when there is such confusion, you can easily fall back to the original printout. So there should be good record keeping. Don't be quick to discard some printouts. Then storage guidelines, retention and disposal. Keep records for the required retention period. There are digital regulations that stipulate how long you have to keep digital reports. So keep records for the required retention time, then shred to maintain confidentiality. It's not that there'll be a copy that you have is in the lab, then after some years, they now see it with somebody that is selling by the roadside. So when it is going to leave the lab, then after the retention time, it's good to shred them to maintain the patient confidentiality. Then protecting records. If you're using a paper-based systems, you know papers are fragile. There are many things that happen. Sometimes somebody might keep a bottled water on the clean area and the thing falls over and spills on the paper. So these are the problems associated with use of paper-based systems. Papers are fragile and vulnerable to water, to fire, to pests. Some rats can eat paper. So storage must be secure. Protect records from every form of damage. Store records in a secure area that safeguards against environmental hazards like water, fire, and pests. Okay, so when you are now transitioning, if you've gotten the required resources and the operational capacity, you want to transition to digital systems. A laboratory information management system is a computerized system designed to manage laboratory data, streamline workflows, and improve efficiency. Just like the paper-based system has some advantages and disadvantages, the LIMS also has some benefits. A well-designed laboratory information management system reduces errors. It speeds up data retrieval and enhances overall lab operations. It also ensures easy tracking of samples and generating reports for healthcare providers. You know, errors with LMIS, you don't have confusion with the data entry. So with legibility of handwriting, these are some of the errors that are eliminated with the use of laboratory information management system. So if you want to adopt a laboratory information management system, there are options for you. You might want to do in-house development. There are some software that can be configured to serve your needs. Then when you have the required resources, you can now upgrade. You can use Microsoft Access. It can be configured and then it provides a local laboratory information management system for use. Then when you now get get more resources, you can upgrade to commercial systems. These ones, you need to purchase them. These ones are fully developed systems. They have the hardware, they have the software, and those that help to install it in your facility, they will now train your staff. This book if you look at your right side, you see this book, Laboratory Information Project Management System. So it's a guidebook for international implementation, particularly in resource-constrained environments. So this book can help you on implementing the laboratory information management system in your lab. The book is very helpful, so I recommend that you read it if you want to choose the laboratory information management system to implement in your lab. So for this in-house development, using tools like Microsoft Access to create a custom system, this option is cost-effective, but it still requires some technical expertise. Then the commercial ready-made solutions with hardware, software, and training. Example, commercial systems, they are more expensive, but often offer comprehensive support. Importance of choosing a system that fits the laboratory needs and budget. So you have to know what you need and then the system that can satisfy it. You don't go to high-end systems when the needs are not commensurate with what they offer. So you can be doing stepwise implementation. So when you read this book, you get more information on how to adopt a particular laboratory information management system in your lab. Okay. Despite the particular one you want to implement, there are things you need while selecting the right laboratory information management system for your lab. The key considerations are purchasing decisions are often made. The challenges we have, there are some places, the management, maybe the IT unit or the finance department or the admin, they just choose the particular laboratory information management system to adopt in the institution without recourse to the laboratory laboratorians. So that is not good practice. It's usually good that before anyone is adopted, that you make your input to know whether the thing is going to meet your expectations. For instance, when you've read that book and you now see the things that the key things that you need to consider before you implement, you'll be able to guide the management on the appropriate laboratory information system to get. You know, they might get this electronic health records that has laboratory information management system incorporated in it. So they might just get input from the clinicians and just tell them what they need. They make sure this one can capture, they can build patients, they just get it. And then there are deficiencies in the laboratory information management system. That's why you equally need to make your input to tell them that anyone that they need to adopt that meets your expectations. And the good thing is that there are many commercials. So if you go through maybe one, two, three, you'll be able to get the one that is going to meet your expectations. And then they should equally have the capability that you can upgrade. So these are the essential features of laboratory information management system. So don't make the mistake of selecting systems that increase overhead without improving functionality. You're just paying maintenance fees and it doesn't make the work faster for the laboratorians. The essential features of a laboratory information management system: flexibility and adaptability. The system should accommodate changing lab needs. You might be offering, let's say, 30 different tests in clinical pathology department. Then next year you might upgrade to 40. So the system should be flexible and adaptable, that when you move to 40, it accommodates you. If you move to 50 tests, it accommodates you. Then ease of evolution and support. Ensure the system you get can grow with the lab and has reliable technical support. If you don't have, when you encounter challenges and you don't have ready technical support, then you shouldn't embrace such a laboratory information management system. Then the speed. A slow system is worse than paper system. Any system you get must be fast enough, otherwise it's going to frustrate the users. And before you know it, they will shy away from using the laboratory information management system, particularly if you are still using laboratory information management hybrid system, combining both the computer and the paper. If the computer is not fast, they'll just be entering the results on the paper. So at the end, work done will be zero. So it's good to get a fast system, a fast, user-friendly LMIS. It will save the time and encourage the staff to embrace it. But if it is slow, they will shy away from it. So the laboratory director must provide input to ensure the selected system enhances efficiency and productivity. In the laboratory information management system, if it saves time, if it simplifies the workflow, the staff, they will quickly adopt it and drive its success. Okay, these are the advantages of a computerized laboratory information management system. The first one is error reduction. Computerized systems reduce errors through built-in checks. You know, if you're using laboratory information management system, you have some mandatory fields. For instance, it wants you to put the age. It will give you, if you click, you see a drop down for you to choose the age. So you cannot put AD, adult. So these are the good things about it. And there are some mandatory fields. You must put the surname, you must put this one. If you don't put it, you will not go to the next page. So the error reduction is one of the advantages of using a computerized laboratory information management system. Automated alerts for inconsistency. When there are inconsistencies, maybe one person inside one, another person inside another thing, it can alert you. And then legible data minimize mistakes. That one, you don't have problem with somebody's handwriting. Everything is clear. So mistakes are minimized. Then quality control management. Another advantage of it is quality control management. It's easy maintaining, analyzing quality control records. It's not this one you have to print out and be going through and get. So this one is very easy. You see it. Everything is digitally done. Automated statistics. It can generate statistics. It saves time and improves accuracy. So anything you want to get, if you just want the urea for this month, you can just say you want the urea results in the last 5 years. It's very easy. It gives you the statistics. Then data searching. There's flexibility of retrieving data using various parameters. Examples, you can search by patient number. If you know the patient number, patient ID, you can just put it and get the details of the patient. If you know the patient name, you can just put in the name and get the details. If you know the test that was done, you can put it and you see all the tests that were done. You can now see the patient name. So it's more efficient than manual methods. Manual methods is more cumbersome. Then patient information access. With laboratory information management system, accessing recent and historical data for comparison is made easy. You may want to see all the results patients have done in the last 2 years. You can see it. Once the patient details comes out, you see all the results of the patient. So patient information access is made easy with laboratory information management system. And then report generation. Once you see a report, unlike the other one, when you use the paper-based system, when you see a report, you don't go and get a clean lab form. You start entering it, and which is even prone to errors. This one, once you see the result you need, you easily print it out accurately. Okay. Additional benefits of the laboratory information management system: tracking and analysis. Knowing who performed the work and when it was completed improves accountability. We say that in the laboratory information management system, there is traceability, it leaves audit trails. Anything you do is signed against your name. If somebody enters the results and then you go and change it, to say the first person is the person that entered this result, and then it was changed by this person. That's why you log in. Once you log in, anything you are doing there is recorded against your name. And if you don't log in, you'll not be able to access it. So these are the benefits of the laboratory information management system. Patient confidentiality. Restricted access ensures only authorized personnel view sensitive information. You know, if you're using a paper-based system, someone's relative might just come and maybe he does HIV test. A cleaner, you know, cleaners usually come very late in the morning. So it might just come into the lab and open the logbook and see, they know the patient's name, they know the lab number. They just say, okay, this one's result HIV positive. So because that logbook is just on the laboratory clean area. So, but with laboratory information management system, there's patient confidentiality. That cleaner will not have access to log into the system and will not be able to see the patient results. So these are the benefits of using a laboratory information management system. Then financial management. Some LMIS can handle patient billing, streamlining administrative processes. So patient is billing, so you don't have any problem of a patient paying and getting a receipt, and it's not it's not reflecting in the laboratory accounts. That one, everything is done on the laboratory information management system. Then integration. Direct data transmission to healthcare providers improves efficiency. Some laboratory information management systems can be integrated with electronic health records. You now get your results, and then the result is uploaded and the physician sees it in the clinic. These are all things that can happen with laboratory information management system. Then training. Proper training ensures that staff can fully utilize the system's capabilities. Just like you have your phone. The phone has capabilities, but it's not, most times we don't optimize the capabilities. We just maybe check WhatsApp, make call, and do a few other things. But there are many functionalities. With training, the laboratorians can maximize the capabilities of laboratory information management system. They say that anything that has advantage also has advantages. So these are the advantages of computerized laboratory system. Training. The staff must learn new workflows, which can take time and resources. You know, with paper-based system, within a day, you can show the person, if somebody comes, this have the phlebotomy, this is the record, you enter the lab, this the where you enter the result. After the test is done, you enter this result in this book, and then when the result is out, you copy that from this book and enter into the lab, the request form, and give back to the patient. Within a few minutes, you are done with the training. But if it's a laboratory information management system, it takes time, it takes days. The person has to be supervised, mentored. Okay, these are some of the advantages of using a computerized system. It takes, and while the person is learning, the person is prone to error, which you have to guard against. Then adaptation time. Staff face challenges when transitioning from manual to computerized systems. Tasks like error correction, You know, when the system wants them to fill mandatory fields, the thing frustrates them, getting the age, putting the surname, very odd. It will astonish them. If you don't fill this field, you cannot proceed. So it takes time for the staff to adapt. And then the cost. We all know most of the key challenge that frustrates people from upgrading to computerized system is the cost. It costs to purchase, to maintain, and then to do periodic upgrades. They can strain your budget, especially when you are in a resource-limited setting. And then another disadvantage is physical restriction. When you are using computerized-based system, the computers you get, they require dedicated space. You have to get power. Sometimes you get solar, you get power, you get batteries, and then you now need extra space where you can store this new equipment you've got. Then you have to maintain. There are some equipment you get, they will give some environmental condition. You might need a air-conditioned place. So these physical restrictions is a limitation in the adoption of computerized laboratory information management. Then backup needs. If you are using computerized laboratory system, you don't have to be backing up, because if you don't do that, you might just wake up one day and you want to log into the system and you cannot log in. So there's need to back up periodically. Importance of regular backups to prevent data loss. A system crash or damage disk can result in catastrophic data loss without proper backups. Okay, can you answer this question? Question 5. A private diagnostic lab is evaluating different laboratory information management system options. The laboratory director wants a system that integrates with existing hospital software, supports automated result reporting, and ensures data security. Which factor should be the highest priority when selecting a laboratory information management system? A, the system's ability to generate financial reports. B, compatibility with existing hospital software and data security features. C, the number of pre-installed laboratory test templates, the affordability of the subscription cost. Okay, enter the result, the answer. Okay, I can see the answers. Okay, yeah, B is correct. Okay, we continue. Thank you. Yes, the answers are correct. Optimizing laboratory data handling. Optimizing test requests and data handling. Use of standardized forms ensure consistency and reduce the risk of missing critical details. Mandatory field in LMIS. Logs and worksheets. Logs and worksheets provide clear. Okay, we've explained this previously. Error prevention. You know the advantages, some of the advantages that the digital system has over the manual system. Error prevention during manual processes, and then during digital when you're using computerized systems. If you are using manual system, then you have to be very detailed and diligent in filling it properly. And then if you are making keyboard entry into computerized system, you have to equally be careful of what you are entering there. If you are doing transcription from worksheets to reports, you have to be diligent. Whether you are using a paper-based system or a digital system, you have to be diligent in making sure that you enter the correct information. And then having two people verify data transcription, it can help to reduce errors. So it's always good to have another eye. Maybe somebody has entered the result on the worksheet. Then that a different person should be able to maybe move it from the transcribe it from the worksheet to the request form. So it's always good to have two people that look at it and not just one person that enters it and transfers it to the request form to give to the patient. Protecting data and patient confidentiality. Data protection. For paper-based systems, it is important to use durable materials. So that's one way of protecting data. So to use durable materials, there's what is called acid-free paper. So it's not just any paper that you use to enter results, particularly for the worksheets where you enter the result for particular analysis. It's good to use durable papers, acid-free, and then when you are done, they should be stored in a locked cabinet so that it's not everyone that accesses such critical information. Then if you are using a computerized system, how to protect data is there is need for regular and scheduled backups to prevent data loss. With backups, data can be recovered in case of system failures or cyber incidents. We are going to see some cyber incidents that can threaten the integrity of laboratory results. Another way of protecting patient is maintaining patient confidentiality. Confidentiality is a cornerstone of trust in healthcare. Labs are ethically and legally obligated to protect patient privacy. Measures such as encryption are described what encryption is. So you, for instance, you get a PDF, you cannot open it because it's passworded. Another measure of protecting patient confidentiality is access controls and audit trails may be used to enhance confidentiality. With such measures, only authorized persons can view sensitive data. And the laboratory director has the responsibility and is accountable for creating a culture of confidentiality and compliance. Lab staff should also be trained on privacy protocols so they can understand and follow confidentiality policies. And what you can easily do is any staff that is being onboarded in the lab, they have to sign confidentiality documents to make sure that they are not going to disclose patient information. Every person has to sign it. Okay. Effective laboratory reporting, key attributes for test reports, timeliness, delays can impact patient care. For instance, we say that if somebody wants to make a diagnosis for, he wants to do dialysis, he might need electrolyte urea creatinine result before he can do that. Accuracy. Errors can lead to misdiagnosis or inappropriate treatment. Legibility and clarity. Reports must be easy to read and understand. A well-structured report ensures healthcare providers can act quickly and confidently. Okay, content of report. Report should include all relevant information, such as patient details, need for verification and signatures by authorized staff. Verification ensures accountability and reliability of the results. And the delivery methods, the ways you can deliver your reports, if it's paper-based, so that one you just do it by the hand. Then if it's laboratory information management system, that one the thing is uploaded on the laboratory information management platform. Then urgent results, that one has to be communicated by phone. But as you are doing such communication, the caller's signature, the date, the time, the recipient's name, these are all the things you need to keep, the information you need to keep for proper quality control. And then when you have given urgent report, there's a critical value. Let's say you got a potassium of 7 millimole per liter, and then you form the health providers on phone. So later you have to follow up with a written report. Such documentations help to maintain a clear audit trail. Importance of test reporting, the test reports reflect the laboratory's professionalism and credibility. Because when you look at a laboratory report, you can say so much about a lab. Just looking at the laboratory reports, you can say so much. Is this a professional? Do you have professionals working there? Just looking at the laboratory, just get 2 laboratory reports and you're looking at them. You can say which people are diligent in the work that they are doing. Effective, okay. Okay. Effective communication in laboratory information system. There are ways you can communicate. Communication in laboratory information system, it can be internal communication, it can be external communication. In internal communication, we're talking about systems being robust enough to share information within the lab. And the way you can share it, it can be through the logbook, it could be JITR dashboards or shift reports. So you can just do your work, enter the result, and then you go. And that person comes on the next shift. You should not have difficulty in knowing where you stopped by just looking at the information on the logbook, whether on the paper or in the computer. The person should be able to know where you stopped and continue from there without even having to call you. Then external communication, that's when we are talking about communicating with the customers, the stakeholders. There should be clear policies for communicating with external stakeholders, such as healthcare providers, referral or reference laboratories, and official agencies. So communication channels, there have to be appropriate channels of communication. The communication might be done through email, through phone or formal reports. And then timing. When do you communicate? When and how often? Everything should be stated clearly. And the people that can communicate, it's not every person that can communicate results. There has to be authorized personnel. It's not the person that does the test that necessarily has to communicate the results. Someone else might need to look at the results before he communicates the result. So these are internal communications and external communication. And it's important to have effective communication because when there's good communication, it enhances coordination, it reduces errors, and improves customer satisfaction. Also, it helps to build strong relationships and trust with external stakeholders. This is digital transformation and data integrity, ensuring data integrity in digital systems. So we are now coming to digital systems. We have seen some of the security measures you have to put in place if you are using a paper-based system. And then if you are using a digital system, there are equally security measures, even more security measures that need to be in place. Data integrity ensures accuracy, consistency, and reliability of laboratory data throughout its life cycle. There are principles that guide ensuring data integrity in digital systems, and it's called our core principles. It serves as the foundation for ensuring that data is accurate, traceable, and secure through its life cycle. So in this core principle, what does A stand for? A is attributable. It means that data must be traceable to its source. Any data must be traceable to its source. Data must be legible. Records must be clear and readable. Contemporaneous. Data must be recorded in real time. Don't say, okay, I know this real result is 5 millimole per liter. Let me just go and eat. And then when I come back, I'll enter the result. No. Results must be entered in real time. Then, next one is original. The first recorded data must be preserved. Even if you enter, let's say 5, and then you need to now, you did a repeat and you need to change it. That original data you enter must be preserved. That's the O. Then accurate. Data must be free from errors. Data must be free from errors. Then the plus means complete, consistent, enduring, and always available. So we look at this next one, the best practices in ensuring data integrity in digital systems. These are the best practices. You know, we saw best practices when you are using paper-based system. So this one is the best practices when you are using digital systems. And the first one is the audit trails. What we are saying is that any system you are getting, the thing you have to look at, one of the things you have to look at is the audit trails to make sure that any information that is entered there, that the person that entered it, the name is against the person that entered it. So that's the audit trails. It helps to track any changes made to records, ensuring accountability and preventing fraud. Then there should be role-based access control. So you have access, a laboratorian has access to do a particular thing on the system. So he logs in with his password. So there should be role-based access. Maybe where the system is, the room might even be passworded so that there is not every person that can gain access to the room. And then when they enter into the room, there has to be access to different parts of the laboratory operation. So there are those that just need access to the phlebotomy aspect. When they collect the sample, they enter the details. So they shouldn't have the privilege of seeing the patient results. So there are those that do analysis and then enter results. There are those that do validation. So they have different access control, access privileges to different aspects of the laboratory operation. So that's another good practice when you're using the digital system. And then the next one is regular data backups. It protects against data loss due to cyber threats or system failures. And then compliance. Any system you use must be compliant with regulatory frameworks. Okay. The next one is cyber security in laboratory information system. Protecting cybersecurity in laboratory information system is critical to protect sensitive patient data and maintain system reliability. Common cyber threats, we have what is called phishing attacks. In phishing attacks, you have deceptive emails that maybe you get a SMS telling you to log in. You have email telling you, you think the email is from the organization. So it tells you to log in your password. And then when you now, if you put in the password, they now harvest the password and log into your details and then steal patient information. So this one is phishing attacks. Another one is ransomware. This malware that encrypts data. Sometimes maybe you just want to log into your platform and you see that you no longer have access. And then you get an email that you should pay some money before they can reopen the platform for you. So that's ransomware. So these are all common cyber threats. Then you have unauthorized access. Another common cyber threat is unauthorized access. Unauthorized access occurs when individuals gain entry into systems or data without proper permission. So it's usually avoided when you do two-factor authentication. You know, if you are using your organizational site and you are putting your password as 12345, someone can just come online and be trying different passwords. You can put your name, you can put 12345, and then if your password is 12345, the person enters. That's unauthorized access. And the way to avoid that is to use two-factor authentication. Even WhatsApp, you see people's WhatsApp platform being hijacked because they used very passwords that are not strong. You used weak passwords. Then data leaks. It refers to accidental or deliberate exposure of certain information. For example, a laboratory employee mistakenly emails a file containing patient personal information. Maybe he wants to send it to a particular person, he mistakenly send it to the wrong person. So these are data leaks. So the best practices for cybersecurity, you have to implement strong authentication measures like multi-factor authentication. Laboratories must enforce multi-factor authentication and role-based access control to prevent unauthorized access. You can also use encryption. For instance, if the file you are sending, let's say it's PDF and it's passworded, when you send it to the wrong person will not be able to access it because it's encrypted. And then also maintain regular backups and updates, regular updates. You know, every time you get app, the thing is upgraded because anytime it is upgraded, some vulnerabilities are fixed. That's why it's important to regularly update your system. Compliance with digital regulations. Compliance with digital regulations is concerned with ensuring that digital laboratory systems adhere to legal, ethical, and regulatory requirements for data protection and quality management. Quality and competence standards for medical laboratories. So there are many frameworks. You have the ISO 15189, and then you have the NDPR, that's the Nigerian Data Protection Regulation. Nigerian data. So this one, you have people that regulate health data in Nigeria. It's called the NDPR. There are some hospitals you hear, oh, that they went and closed because they were not properly ensuring personal and health-related data are properly secure. So in Nigeria, we have the NDPR. In Europe, you have the General Data Protection Regulation, GDPR. In America, you have the IFCAP, that's the Health Insurance Portability and Accountability Act. So these are different, but the one that you come across in Nigeria is the Nigeria Data Protection Regulation. So what you are doing in the lab is not just your business, it's the business of the government. The government has an agency to ensure that patient data and confidentiality is given utmost priority. Essential compliance measures, data protection policies. There are clear guidelines on handling patient data. If you want to know more about that, you get the NDPR. They have clear guidelines on how you have to handle patient data. Access control measures, how to ensure that the wrong persons don't access patient information. Audit trails, every person that enters into the system must leave a footprint. Regular security audits and staff training, data retention policies. All these things are in the Nigerian Data Protection Regulation guideline. When you go through it, you know all that is required of you as you're handling patient data. Okay, let's go through this question before we go to the last section. Question 6. So the clinical lab experiences a ransomware attack that increased patient data, making it inaccessible. What is the most effective strategy to protect laboratory data from such cyber threats? Keeping all lab data stored on a single local computer, implementing regular data backups and multi-factor authentication, allowing only one staff member to have access to the LIS, printing all patient reports to store physical copies. Okay, the results are coming in. Okay, yes. So we continue. AI in laboratory quality management system. We've been hearing about AI. Does it have application in diagnostics? AI-driven technologies enhance diagnostic accuracy, speed, decision-making, and efficiency in laboratory medicine. The key applications you have medical image analysis. AI algorithms interpret radiology. There was a time that Elon Musk was saying that if you have an X-ray, you should upload it on Grok. There's one AI platform that he developed, Grok. So some radiologists, what they just did, they just get the radiologist film and upload it, and then see what the response of the AI model is. But they didn't educate it. So what they were just saying, they were just in the chat box, they were just wrongly. All the places was getting it wrongly, but they didn't educate it, because if you upload the radiology and then it gets it wrong and then you educate it, next time it will do better. So that's one way AI can do medical image analysis. It can pathology slides, even pathology slides. You just upload it, you interpret it, you tell you these are areas of inflammation, and then make diagnosis. If a pathologist educates it, next time it gets better. But the thing is that it has its own risk. If you go and educate it, then you are just putting yourself out of job. So these are the challenges. It's like, yeah, I want to take the role of the pathologist, and pathologist doesn't want. So, but this tells you the challenges that the profession is going to face in the future. AI can also There's also what is called another key application in diagnosis. You have predictive analytics. AI models, they use patient data to assess risk factors for chronic diseases. So they can check the risk factors. It has access to the results over time, your clinical details, your demography, everything. So you can make suggestions of those that are at risk of coming down with chronic diseases like DM, cardiovascular diseases. So this can aid early intervention. The AI model you can use because it's embedded in the electronic health records. So you can flag those that are at risk of coming down with heart attacks, prompting doctors to intervene with lifestyle advice or early treatment. AI also has role in automated laboratory testing. AI-powered analyzers can optimize test accuracy and efficiency. It also enhances laboratory workflows by minimizing manual errors and ensuring high throughput and accurate results. A fully automated blood analyzer in clinical chemistry can use AI to detect sample abnormalities and recommend repeat testing. You can say, okay, these ones, they need to do a repeat. Then virtual assistants, you have virtual assistants. For instance, you have a chat box on a hospital website. You can ask a patient about their symptoms and then they schedule appointments with the appropriate department. Like maybe someone complains of frequent urination, of eating too much, of gaining weight. Just chatting with a virtual assistant, and then it now tells you, okay, come to the hospital, go to endocrinology unit. The person just goes straight to that place. So these are the applications of AI. And then personalized medicine. AI can interpret a patient's genetic profile and suggest the most effective chemotherapy drug. If someone that has cancer, it checks your genetic makeup and says, okay, this cancer drug might be more effective than the other one. The benefits is faster and more accurate diagnosis, reduces human error, improves efficiency, enhances disease prediction and prevention strategies. The challenge is high implementation costs. Before you can get, for instance, get an auto analyzer that has AI. You have your phone, you have AI, but many analyzers will have, they don't have AI. But the analyzers of the future, the ones that are rolling out, are the ones that have AI that can make some input. The challenge is high implementation costs, data privacy concerns, need for validation and regulatory approval, and then potential resistance from healthcare professionals, those that think that AI will take their job. They will not cooperate. And even the regulation now does not support this regulation. When you go through the Nigeria Data Protection Regulation, it does not support imputing patient data on such platforms that AI can use. AI in laboratory automation. AI enhances laboratory processes by automating routine tasks, improving efficiency, and reducing human errors. So you can see AI in automated sample processing. For instance, if in a clinical lab, you can see robotic arms equipped with AI algorithms. You can manage hundreds of blood samples per hour, something that might be difficult for a human being to do. So you can handle more samples. Then you have smart analyzers. AI-enabled chemistry analyzer automatically recalibrates itself when it detects minor performance drips. It can prevent, so you just see that the machine is going down and it recalibrates itself. These are smart analyzers. Then you have automated data interpretation. An AI system reviewing hematology results. It flags a suspected leukemia. Okay, it sees this one. Okay, all these slides, they are normal. And then it sees the one that is suspected to have leukemia. It flags it. And then the pathologist will just look at that one that it has flagged. So it makes the work very easy. So pathologists can attempt to just go straight, instead of going through many normal slides. It just goes to those ones that AI has already flagged as deranged. Then inventory and supply chain management. The lab management system uses AI, it can forecast reagent needs based on test volume. Based on the volume of tests, you can tell you, okay, you need to reorder for reagents at this so and so point. Then workflow optimization. AI in emergency cases, it can schedule those that need to reorder you can, based on the results that you get, you can say, okay, these ones have suspected heart attacks. It gives them priority over those that have normal findings. So you can see, instead of going through many normal patients, just quickly by the results, even before you know, they just quickly prioritizes those that have the range results, those that have serious conditions, so that you can start attending to them before you go to those that are normal. The same benefits, increased efficiency, challenges, it's high initial investment, you need to train the staff, and then regulatory compliance. Before you can use them in the lab, they have to be approved by Nigerian Data Protection Regulation. Then in quality control also, AI is also applicable in quality control. AI too, it can flag a batch of test results where potassium levels are usually high. You can flag them. You can do predictive quality monitoring. For instance, you have an immunology analyzer, it uses AI to predict when a reagent probe will fail, prompting preemptive replacement. You can take this machine, okay, this one is now failing. You need to replace this part. Then AI can also help in real-time quality assurance. It can detect minor temperature fluctuations affecting assay performance and recalibrates in real time to maintain result validity. Then data standardization integrity, and AI too can standardize reporting formats for HbA1c measurements across multiple laboratory branches. You know, there are some places they use percentage when they're using HbA1c, there are some places they use the millimole. You can standardize it across platform. No matter the result the system produces, it can give you same units in different platforms. Then machine learning for continuous improvement. A lab's AI system becomes better at predicting which sample types are most prone to clotting issues, leading to revised pre-analytical guidelines that reduce error rates. So the use of AI in laboratory quality management system is just so vast, and the thing keeps changing almost on daily basis. So with all this, what are the challenges? The common problems in laboratory information management system, we have seen some of them in the course of the presentation. Problem of incomplete or illegible data. That one, using the electronic system can help you with it, because that one has mandatory fields. Anyone you don't fill cannot proceed. Another challenge with laboratory information management is poorly designed forms. And what you can do, you can get input from end users when you are designing your form. Inadequate standardized forms. So you can adapt your forms to fit your laboratory. You don't just have to copy from one big lab and implement in your own lab. You have to adapt it to your own requirements. Data retrieval issues. Lost data can disrupt operation, so you have to regularly back up. Poor data organization. Disorganized data can hinder analysis for research or audit. So you have to use standardized formats. Then system incompatibility. A lab instrument that doesn't integrate with the laboratory information management system can lead to manual errors. So as you are getting a laboratory management information management system, make sure that your equipment can integrate with it so that the results can move from the equipment to the laboratory information management system. So these are some of the challenges and the ways they can be overcome. Then in digital transformation, what are the challenges that one might face if you want to move from paper-based systems to digital platforms? We all know the first one is the cost. The first one is the cost, high implementation cost. And what you can do, you can start with a phased approach by prioritizing critical digital tools. So what you can do, you can say, okay, you implement the laboratory information management system in, let's say, chemical pathology department. From there, you can now move to hematology. Maybe if it's very difficult to just implement the system on all the 4 or 5 units, you can just start from one department, you now move to the next department. And then for you to, if it's expensive to get to get a backup system. You can be in the cloud. Another challenge of digital transformation is resistance to change from the laboratory workers. So what you can do to solve that problem is you can conduct regular staff training, tell them the benefits, how they think can make their work easier. Another challenge is data security. We have talked about all these cyber threats, phishing emails, ransomware. Okay, what can you do? You can implement strong cybersecurity frameworks, encrypt your data, do multi-factor authentication. The thing can help you. Then system integration issues. What you can do, you have to get a system that can easily integrate with the hospital's electronic health records and can also integrate with your laboratory instruments. Okay, then technical maintenance. In anything you are getting, just make sure that you have the worker, the support, the technical people handy. You don't get a device that you are in Enugu and then the technicians are in Abuja. When you run into problems, they find it difficult to help you. So get one that you can easily get the technical support handy. The other challenge is the regulatory and compliance barriers. Anything you are getting, if it's against the Nigeria Data Protection Regulation guidelines, it will not fly. Okay, the evolving role of laboratory information management system. There's evolve beyond basic data storage, and before we're just concerned with, when we're talking about laboratory information management system, just concerned with data storage, sample tracking. The thing has now becoming more sophisticated. You now have AI integrated in analyzers in your laboratory information management systems. All this will help to improve the efficiency, accuracy, and clinical decision making. So these are, the thing is fast changing. You now have data, modern LIS, use AI and machine learning. You have connectivity and integration. LIS now integrates seamlessly with electronic. So you have devices that are coming with AI. So you have to be abreast of what is happening. So you see the one that you can implement in your facility, particularly if you have the resources. Then future trends. Future trends. What is in the horizon? You have AI and machine learning in diagnostics. Will enhance predictive analytics, automate data interpretation, and reduce diagnostic errors. For instance, AI software like the one with IBM, it can assist pathologists by automatically analyzing biopsy slides. So that's what can happen. So pathologists can use that tool to analyze slides instead of just maybe analyzing 30 slides in a day. With the help of AI, you can analyze thousands. Just isolates, just tells, extricates all the abnormal ones, and then you can put time and effort on those ones. Then you have cloud-based laboratory systems. So what is going to happen in the future? You have cloud-based platforms, so they can be remote access, seamless data. Most laboratory information management system in Nigeria, most of them, you need to be in the hospital environment before you can use them. But with time, anywhere you are, you can access them. You can make your inputs. You can access them in different devices. You can access them on your phone, make your input. You can, even on wearables, the watches, you can access them. The hospital moves its laboratory information management system to a secure cloud platform. So when it's in the cloud, like Microsoft Azure, it allows laboratory staff and doctors to access test results remotely from any authorized device. Then blockchain for data security. This technology will provide tamper-proof audit trails, ensuring data integrity and preventing unauthorized modification. Interoperability and integration. We talked about how you can easily integrate your LIS with the equipment, with the electronic health records. You have this in your wearable and point of care technology. So Someone, a patient that has diabetes, can use wearable glucose monitors that automatically uploads real-time glucose levels to the laboratory monitoring system. So the patient might not know what each result is, but as doing the test, the result is being uploaded on the laboratory. So when they now see, oh, the thing is getting deranged, the patient can be called to come to the hospital, and then maybe the medications can be adjusted. Okay, regulatory evolution, we have to be updated on what Nigerian data protection regulation is up to at every point in time. Then cyber security enhancements. The laboratory deploys an AI-driven cybersecurity platform that continuously monitors network traffic. So that's one way the thing can help. In all this, the thing can be, AI can be monitoring your platform to check maybe, are there some suspicious behavior, such as somebody is trying to gain access, is inputting passwords several times. AI can detect that and then isolate the affected system. If it's in the electronic health records, it can isolate and shut that one down while the laboratory information management system and the equipment are still functioning. So AI can be doing like policing of the whole system, so that anywhere you have suspicious behavior, you can identify it. You can equally signal the technical people so they can maybe upgrade the platform. So these are where we are going. Okay, so in conclusion, digital transformation is revolutionizing laboratory quality management system by enhancing efficiency, accuracy, and data integrity. Effective information management is critical for ensuring compliance, security, and streamlined operations. The transition from paper-based to digital systems requires careful planning, selection of appropriate technology, and staff training. AI and advanced digital tools offer immense potential for laboratory automation, quality control, and diagnostics. Despite challenges, the future of laboratory information management is shaped by continuous innovation, regulatory compliance, and cybersecurity advancements. The final words: digital transformation ignites excellence when powered by effective information management. Okay, I think the floor is now open for questions. Hello. Hello. Can you hear me?
Yeah,
Yes,
Chief, we are
I
with
can
you.
hear you.
Yes.
Thank you.
Hello, we can hear you.
I was wondering if I'm talking to myself.
Oh, yeah, we see
Hello.
you, sir.
Okay, please ask your question.
Thank you very much. Thank you very much, very much, Dr. Mba, for the presentation. I was actually looking for my unmute button, and that was why I didn't chip in earlier. So please, the floor is open for questions, reactions, any observations based on today's presentation. We would like to take that quickly. So the floor is open for all the participants to chip in something. Thank you very much.
Thank you so much, Dr. Mba, for the wonderful presentation. I must say that it was a very immense contribution to knowledge. It was very deep. Thank you so much, sir. My major question is the aspect of the blockchain for data security. How can it be more broken down in a better way? I understood close to 95% of the teaching, but that aspect of the blockchain for data security, I need a little extra explanation. And if you can also give a very practical example on how AI can achieve laboratory automation. I know we are gradually evolving in our labs in some places. to laboratory automation. So how practically can we deploy AI or machine learning algorithms as we are entering this evolution in some of our labs that are getting into automated laboratory workflow systems? Thank you, sir.
Okay. Yeah, thank you very much. When we talk about blockchain, there are many advantages the thing provides. But the one that we emphasized in this lecture was the audit trails, because there are many commercial systems that are out there, and it's not all of them that can track every activity on the system. So with blockchain technology, one thing it does is that in addition to enhancing security, it equally tracks every activity. It tracks every activity that takes place in the platform. So it enhances security. You know, security something is of utmost importance when you're talking about a digital platform. So the blockchain technology, it makes it very difficult for any intruder to access patient information. So these are the key things the thing does. It enhances the security. You know, there are different the people that want to cause harm to patients, that want to access patient information, that want to seize. Like last year, there was a time that North Korean agents were reported to they were stealing, they just block access to people that want to log into a particular system, and then they will say you have to pay using cryptocurrencies. So with blockchain technology, the thing is reduced to the minimum. That any one that is not authorized to work on the system, once you come and you are fiddling at the back end, then the thing is able to, just like you have someone that is on the vanguard, the security, he just sees any suspicious movement, he now alerts the authorities, then they can be monitoring the person. So blockchain helps with security, optimization of patient data, and then the audit trails. So any activity, whether from authorized or unauthorized persons, the activity is well detailed. You have different platforms that have, maybe they can be, you can give footprints for those that enter results. They don't track other changes. But when you have a holistic tracking of every activity, both from authorized persons and unauthorized persons, so that technology is made possible by the use of blockchain technology. And then the machine learning, you know, we talked about Elon Musk. Any AI tool that you are using, it has to be taught. The thing is that when you teach it, it will now become more efficient than you, the teacher. That's what happens. When the thing is taught, but it learns fast, and it takes it to a whole different level. So that's what it does. No matter, you can see when you use, for instance, you ChatGPT, and you use this one from Google, I've forgotten the name. If you ask different, input different prompts on these different platforms, you see that you get different answers. So those ones, there are some that have gotten input, they have made mistakes, you told them no, they refined and they got it right. Once the thing gets the right answer, the thing is noted. Next times, it didn't make such mistakes. So they have different levels of training. Then they learn. If you upload pathology slides on Grok, and then it might get maybe 90% of it. If you educate it, next time you get 95%. Before you know it goes to 99%. And that's how the thing keeps improving. And it's getting from billions of people across the world. So any inquiry you are making here, someone has made that inquiry and it has been corrected. So it gives you a more accurate response. So that is, all these things are embedded in the ability of the machine to learn. And the learning is not the learning that we are used to is on a whole different level. So that's the thing that machine learning and blockchain helps. Then AI, the practical application on laboratory automation, even just the example we have given also, when the pathologist has slides, you have slides and then you have the digital copies of the slides. The thing is, a human being will need to be going from slide to slide. But with AI, it can, in a second, extract all the abnormal pathologies. It can extract all the abnormal pathologies. So you might need to go through, maybe when you go through 200 slides, then you find 5 abnormal pathologies. And then you've gone through 100 slides. You were able to see 5 abnormal pathologies. AI can quickly go through it and then select the 5 abnormal pathologies. So as you are coming, you are just going through the 5. You see the first one, you interpret. You didn't interpret for you, but it was able to sort out all these slides for you. The time you are coming, you are spending time, your quality time, going to the 5 pathologies, and then you interpret them properly. Then the remaining 95, you just see all of them you just be looking at them, they are all normal. So you can see the time between space. So this is one of the things that AI can help you. It can just sort out so much data. And it's not just slides, it can equally be urea results. It can even be the whole patient has done so many tests. It can just quickly get all the abnormal ones and bring it to you. You attend to them. Then the other ones are just normal, so no significant biochemical derangement just for those ones. But those ones that are deranged, you have used your effort in going through them. So that's what AI can help you in automating some of these things that you do manually. Okay, I hope I have attempted the questions.
Thank you very much, Dr. Mba. It was quite very well explained. Although because I am from chemical pathology, I can now quickly align it with maybe we have a high volume test, maybe close to 3,000 samples. Maybe by AI, patterns that are generated can also shorten the time. And from there, I'm putting it from the pathology slides. We can analyze close to 3,000 by patterns. We quickly interpret all those results, the one falling in each cluster. And we can quickly get accurate results for even large volume analysis by patterns. But that's what I can imply. I think I got you, sir.
Yes, perfect.
Yes, sir. Thank you, sir.
You're welcome. Okay, any other question?
All right, thank you very much. Is there another question from anybody? You can, let me also state that you can use the chat box by typing your questions and I'll be monitoring to read them out. Alternatively, you can just unmute yourself and ask your question. All right, so in the absence of any other questions, I want to thank you all for your active participation and engagement throughout today's session on leveraging digital transformation and information management in quality management systems. All right. We hope that the insights that have been shared today and all the strategies will inspire a positive change in your approach to your laboratory practices. I want you all to stay tuned for our upcoming sessions where we'll continue to explore critical aspects of laboratory quality management. Next week, we look forward to a topic on developing a skilled workforce, essentially personnel management and continuous education. So let's try to, it's quite an interesting topic and something we should all try to participate in. All right, thank you very much. Let's continue to strive for excellence in our laboratory quality and contribute to better healthcare outcomes. Have a great day, and we look forward to connecting with you again next week. Thank you very much, everybody. Did I see a question on the chat?
Thank you. Thank you.
All right. Have a nice day, everybody. Thank you very much.